Vasopressin binds vasopressin 1 and vasopressin 2 receptors. It's dosed as an IV infusion, usually 0.03 units per minute, or as a bolus of 0.5 to 1 unit. When you give it as a bolus, it works in about a minute and lasts about 10 to 20 minutes. It lasts longer than phenylephrine, so sometimes in the operating room or in the ICU, if you're tired of giving, much more in the operating room, if you're tired of giving boluses of phenylephrine every couple minutes, you end up giving a bolus of vasopressin because you get a longer acting agent on board. V1 leads to vasoconstriction, while V2 causes free water retention at the distal convoluted tubule, as well as the collecting ducts of the kidney. And this works via aquaporins, something that is often tested in the USMLE. Physiologically, it's released from the posterior pituitary in response to plasma osmolality. It can also be released due to hypovolemia, but osmolality is much more of a potent signal for it. And in fact, however, if your hypovolemia is very significant, it'll supersede hyponatremia. So hence the term hypovolemic hyponatremia, where even though you are hyponatremic, the body's hypovolemia overwhelms the signal of hyponatremia and chooses to maintain free water as a form of maintaining its volume status. A couple clinical pearls. Ethanol inhibits its secretion from the pituitary, hence the reason when you have alcohol you tend to pee a lot. And one of the things that I have noticed, which is fantastic, is that in the setting of severe acidemia, pH of 7, 7.1, sometimes catecholamines do not work very well, but vasopressin seems to always come through and work very well as a bolus of 0.5 to 2 units. Side effects include hyponatremia. I've definitely seen it cause some reflex-bradycardia and a decrease in cardiac output because it is a vasoconstrictor without any inotropic effect. Dobutamine is a beta-1 and beta-2 agonist. It therefore increases your heart rate and contractility, and it can vasodilate via the beta-2 effect. It's classically used for decompensated heart failure. You often see it used in the coronary care unit. It's dosed about 1 to 5 mics per kilo per minute intravenously. Its side effects include hypotension or hypertension, depends whether the beta-1 effect leads to increased cardiac output and therefore increases your blood pressure, or the beta-2 agonist component is more important and therefore will lead to hypotension. So you really don't know. You have to be very careful when you start it. It can lead to arrhythmias, especially when you have increasing doses around 10 mics per kilo per minute. Isoproterenol is very similar to dobutamine. It's beta-1 and beta-2 agonist, primarily used in bradycardia, but also increases your inotropy and conduction speed in the AV node, as well as causing vasodilatation. Side effects, just like dopamine, can include arrhythmias. Often dosed IV, 2 to 10 mics per minute, similar to epinephrine. Classically, it's used for heart transplant patients who, because it is a transplant, they're denervated, don't have any autonomic system input. And isoproterenol is a direct agonist of the beta-1. Major side effects include tachyarrhythmias.
Guys, thank you very much for watching. Make sure that you like, subscribe, and share this video. Like it if you like it. If you don't like it, then don't like it. And then subscribe if you want more videos. We upload videos regularly. So if you subscribe to the channel, you can get a notification and the video will appear in your inbox. And if you hit the bell button as well, then you can get the notifications for this as well.